again. Thank you for coming. And so today we're going to do a guided breath practice, and then we're going to do, I'm going to try to do 3 different exercises, okay, at the end. So this is a little review because we have some refinements on the movement of the wave through, on the way the wave moves through the thoracic diaphragm. I originally, and I'm still actually teaching this as a way of experiencing it, that the wave comes up, it goes around the bottom of the borders and meets here, while the wave moves from the front to the back like somebody flicking a parachute and letting that wave travel out to touch everybody's hands. But we've been doing some refinements on that, and I just want to go over that because I think it's really, it's incredibly helpful in making this an easier breath for us. And I imagine there will be further refinements that many other people will make. But here's this one. So the breath is going to come up from the bottom, from L4. It's going to grab the esophagus, pull the esophagus down, and a wave will come up from L4, and it will travel from the bottom of the diaphragm up to the central tendon. When this wave gets to the central tendon, it's going to slow down because this is contractile tissue. When the wave passes through these muscles, their little contraction adds to the wave. So any momentum lost is going to be maintained and even built upon by the participation of this contractile tissue. But once it gets to the central tendon, it will slow down. These waves that come up, and this is really probably where I should have started today, saying this wave that comes up broadens at L1, and it starts to move in a wave-like fashion. It ripples around the bottom borders of the diaphragm, all the way to the sternum, where the waves meet and add to each other. Right? They're going to, their amplitude will be additive. So when that happens, right, that's going to happen long before this wave coming from the back can make it to the front, because it will get dampened in the central tendon and move relatively slowly through here, while these waves will rush ahead with contractile tissue pushing them along. And as they move forward in this ripple, a ripple of contraction happens from the bottom of the diaphragm to the central tendon in a radial fashion the whole way around on both sides. So it's almost like that ripple sets off multiple cascades of contractile waves moving from the bottom border of the diaphragm. So the bottom border of the diaphragm here, moving from there up. So this actually, I probably should have done it this way. The wave moves up from the bottom and comes in toward the central tendon, right? It's going to, when the wave comes up here, up the front, it curves back in and moves from the back, from the front, ultimately moves from the front to the back. And it too will hit the central tendon. But an interesting thing about this, and maybe you can even see if you can feel this as we're doing it, that this, as we've said so many times, there's so much less muscle up here. So much less muscle, right? So it's almost like as a wave coming, well, it's just like as a wave comes into the shore and the depth of the water gets shallower and shallower, it causes the wave to get higher and higher, right? So, and it moves faster. It moves faster once it's coming into the shore. So waves are coming up from the bottom to the central tendon, and those waves will meet the waves coming from the back to the front, and they will meet in the central tendon. And when they do, your breath will get very big and easy. And when you let that happen, when it starts to come around like this, and this stalls, you're going to feel like, oh, I've got to push it through. I need it to go that way. Don't try to push it. Let it stall. Let it go at the tissue's speed, and let these come careening around and meet at the sternum. And then these two waves meet in the central tendon. How was my interpretive finger dance? Interpretive finger dance. Okay. So just want to review that. I think it's really worthwhile right now. So assume whatever position you would like. Seated, standing, supine. Feel free to move from one position to another. There's no need for you to stay in any position that feels uncomfortable to you to the point that you are straining to maintain it. If you're straining, it's really difficult to breathe. So just find a position that makes it better to breathe. If that means you don't pull your shoulders back and lift your chin up, that's okay right now, right? The main thing that we want is for you to be able to get breath into the lumbar spine. So if you're seated, or if you're supine, put something under your legs, like a couple of pillows like this, like bolsters. Put them underneath your knees so that your low back can be flat upon the floor. And if you're seated, find the transition point between the front of the sit bones and the back of the sit bones. Find the transition point. Find the place where, as you roll forward on your sit bones, you find a place where you're not on the front and you're not on the back. You're just resting on that transition point. Notice that you can take a breath there. Notice that you can bring the breath into your back if you're on that transition point. And if you're having to work so hard to bring your shoulders and upper back upright, just don't work so hard there right now. Just make sure that you can get the breath into the low back at first, as well as into the abdomen. It should be a radial expansion. If you're standing, find that same relationship between the spine and the pelvis that you have when you're on the transition point between the front and the back of the sit bones. If you're standing, keep your eyes open. And begin breathing from the bottom of the pelvis up to the top of the chest and emptying yourself from the top of the chest down to the bottom of the pelvis. Remembering that the most important instruction when you practice breathing is to let it be as easy as possible, to let it be relaxed, to let it be something that is softly expansive. Almost as if you're not doing anything yourself. You're not really doing anything by yourself. You can allow the universe to breathe through you. The only muscle that you have to move in order to get your best breath is the thoracic diaphragm. Bring your mind to the borders of the diaphragm where you know it's attached. And even though you know it's attached, feel free to trace those borders with your fingers right now. Touch the bottom of your sternum, the xiphoid process. Touch the bottom of the rib cage all the way around. You don't have to do this, you can just do it with your mind. But bring your mind to the borders of the diaphragm. Notice the sensations of motion you have there as you inhale and exhale. Breathing produces changing sensations. Inhalation feels different from exhalation. The sensations of inhalation are the sensations of contraction. The sensations of exhalation are the sensations of relaxation. Feel the breath come in at L4. Feel it roll up the spine. Feel it grab your gastroesophageal junction. Feel the breath broaden at L1. Feel it ripple around the two bottom borders of the thoracic diaphragm. The bottom borders of the rib cage. Just let that happen. Let the breath come up in a wave-like fashion from L4. Feel that wave broaden at L1. Like a wave split by a boulder at the edge of the ocean. Feel the wave roll around the bottom of the rib cage and meet at the sternum. Feel those two waves becoming one again at the sternum and adding to each other. Let the breath move through you. Take a moment to notice if there's any point at which you feel that you're trying to push the breath along. And if you notice that, and even if you don't notice it, see if you can't relax more. See if you can't uh, see if you can't allow the breath to move at the tissue's speed. Let it ripple around the bottom of the rib cage. Let the two waves meet at the sternum. And then bring your mind to the wave that comes up the spine and goes right to the top of the dome of the diaphragm. Feel that wave coming to the top of the dome of the diaphragm with a great deal of uh, vigor, and then suddenly it slows down as the wave gets to the central tendon from the posterior inferior border of the diaphragm. Let it slow down. Let it come to a seeming halt in the middle of your chest, while the two ripples rolling around the bottom borders of the rib cage careen ahead and meet at the sternum. Feel them initiate a wave from the bottom border of the diaphragm toward the central tendon in a radial fashion, all the way around the front of the body. Let those waves meet. Let those radially generated waves meet in the central tendon. Open up a huge space for your heart every time you inhale. Let the heart move inside the pericardium. Every time you inhale, the little bag that the heart is sitting in gets stretched out. So it pulls the tip of the heart down. Let the heart move. Let the heart spiral in alignment with the great vessels. Let the heart move. Now notice the sensations of motion generated in the abdomen as you exhale. Feel that exhalation produces a drawing sensation among the organs in the abdomen. Let them move. Feel that sensation of drawing reaching all the way to the floor of the pelvis. Feel it lift the pelvic floor, the thigh pits, the back of the knees, the arches. Now bring your awareness to the front of the throat and under the chin. And notice that almost immediately as you begin to let the breath come up the spine, you feel a sense of drawing, a tugging sensation on the front of the throat and under the chin. Be open to letting the lower jaw get drawn into action almost immediately as you begin your inhalation. Be prepared to let the diaphragms in the head function. Let the wave of contraction fully mature through all the diaphragms of the head. Start with the floor of the mouth. Let the lower jaw get drawn back and down. Feel a flux in the floor of the mouth. Feel it get drawn in on inhalation. Feel it puff back out on exhalation. Feel the cooling sensation at the center of the head. Effervescent disco ball of light in the center of the head. If you haven't made your suction seal, by all means make your suction seal. Lay the tongue flat on the roof of the mouth and swallow in a wave-like fashion from the back to the front. And as that wave gets to the back, inhale. Let the lower jaw carry the tongue back and down. Feel the breath come up the back of the head, neck, and shoulders. Feel the roof of the nasal cavity drawn into action. Feel the cooling illumination that floods the spaces between the hemispheres, the corpus callosum, basically every midline structure, including the central canal. Feel the little triangular flap of cartilage on each side of your nose, right above your nostrils. Feel that little triangular flap of cartilage on each side. Allow that little flap to get drawn in on inhalation and puff back out on exhalation. Just go ahead and breathe through all the skin over your whole nose if you want now, as you allow those flaps to move. Feel that you can bring the breath in through that entire area. Let it move. This whole area, this this whole little triangle. Feel that that whole triangle can draw air in, even through the skin itself on the outside. And now the cheeks. Let the cheeks participate. Let them get drawn in on inhalation. Let them puff back out on exhalation. Let them hug and release your teeth. Your eardrums, let your eardrums get drawn in on inhalation. Let them puff back out on exhalation. Let your eardrums move. And feel the cool expansion, the cool and bright expansion of the temporal region as you allow the eardrums, the whole temporal region, as you allow the eardrums to move. And now the temples, what we call the temples, right here. Let this area move. Let it get drawn in on inhalation. Let it puff back out on exhalation. Let the temples move. Feel how the motion of the temples cools off your frontal region. Magic and easy at the same time. Let the diaphragms in your head move. Bring your awareness now to your eyeballs. Feel them in their eyeball sockets. See if you can feel where the bony socket is. And feel the boundaries of the eyeball itself. Now feel for all the tissues in between the bony eyeball socket and the eyeball. The fat cells, the muscle cells. The nerve cells. Feel for the stuff between your eyeball and the eyeball socket. Let that area be soft and relaxed. Every time you inhale, allow the breath to come into the eyes. And every time you exhale, see if you can relax so deeply on the back of your body between the two transverse processes on each side of the spine. See if you can relax there so deeply that you feel the pressure drain out of your head, including your eyeballs. Feel your eyeballs get drawn in on inhalation. Feel them drift back forward on exhalation. Let your eyeballs move. Bring your awareness now to the back of your eyeballs. Notice that as your eyeballs are drawn in on inhalation and puffed back out on exhalation, so are the backs of your eyeballs. And so are the optic tracts extending off the back of the eyeballs. The optic tracts crossing over in the center of the head, like an X on a horizontal plane, extending from the back of the eyeballs, crossing over, and then extending to the back of each side of the head. Feel for the optic tracts extending off the back of your eyeballs. Now feel for the front of the eyeballs. Feel for the borders of your cornea, the clear connective tissue cap over the colored part of your eyeball. Feel for the borders of your cornea all the way around. Feel for the iris. The colored part of your eyeball. Feel for the lens. Just inside the colored part. Let these structures move. Let them get drawn in by inhalation. Let them puff back out on exhalation. Let all of the diaphragms of the head participate. And notice, again, that the head begins to fill almost immediately as soon as you start to inhale. Let it fill. And the 20 diaphragms in the head will have your head full in no time at all. Long before the breath gets to the top of the shoulders from the bottom of the pelvis, your head will be full of breath long before. It's kind of incredibly cool. It's very cool. Your head fills so completely and so quickly that it overflows. The pressure from the head overflows and comes back down to the neck, meeting the wave coming from the bottom of the pelvis to the top of the chest. Those waves meet in the shoulder girdle, expanding it 360 degrees. Let the shoulder girdle expand in all directions. and then relax completely. So let's do some arm and leg breathing. On your next inhalation, you're going to lift the toes. You're going to engage the ankles in the same way you would if you were standing on the floor with your toes lifted. You're going to squeeze every muscle of your lower extremities, all the way up to and including the butt cheeks. Every time you inhale, squeezing all the muscles of the lower extremities. Every time you exhale, releasing every fiber that you contracted. Arm and leg breathing. For the upper extremity, you're going to spread the fingers and the palms. No hyperextension. A little disc shape in the palms. And when you inhale, what you're going to do is you're going to squeeze every muscle of the, I'll just do the arms right now. Every muscle of the upper extremity spread by starting by spreading the fingers. And you exhale, let everything go. Find every fiber that you can recruit to participate in relaxation as you exhale, all the way from the top of the head, now, from the top of the head down to the bottom of the pelvis, the hands and feet. Now let's do some right and left side breathing. I'm going to start by lifting the toes on the right, squeezing all the muscles of the lower extremities, floor of the pelvis. Just a little squeeze right now. And let all the pressure out on the right. Now I'm going to engage on the left side. Alternate sides. Alternate sides. Now, the next part of what we're going to do, keep doing alternate sides. But the next part of what we're going to do can either be done in a chair airplane mode. Boom. Or it can be done standing. It could probably be done supine too. Not really, not this. So either seated in a chair or standing now. If you're not sure how to stand and still breathe into your low back, I recommend doing this seated. So I'll start with doing it seated. And everybody, why don't we all start seated? So what we're going to do, and I think that this is very similar to the Svarupa yoga thing, where they kind of like go down between their legs. I want to do it with a particular kind of breath, though. What I want you to do here is I want you to, and you know, we're going to be bringing our head down. So watch this once. Make sure that this isn't going to cause you to, you know, make sure you feel safe. You don't want to have a big change in your blood distribution that might make you dizzy or something like that. So, so if that's the case, then just wait a minute, just watch and wait a minute, and I'll give you something to do. It won't take that long. So what I'm going to do here is I'm going to start by pressurizing my whole body, and I can go ahead and do that by doing my like sort of lift the toe thing. So this is where the foot is, and then I lift as I inhale. So I'm going to do that, and I'm going to spread my arms, fingers and palms, and squeeze. I'm going to squeeze, gently squeeze. Like this squeeze can be as light as a spider web, right? As light as a spider web. Just have all of your diaphragms have that spider web-like engagement. It can be that light. It doesn't have to be hardcore at all. Soft is great. So I'll pressurize my whole system, and I can do that with a very soft engagement. And as I exhale, I'm going to feel like I'm emptying the front of my body. And as I empty the front of my body, I'm going to bring my arms down in front of me, between my legs. And you can just go however far. If I start to feel restriction here, I'm not going to push through. I'm not going to try to stretch. What I'm going to do is I'm going to finish my exhale down to the front of my pelvis, and then I'm going to inhale, lift my toes, fill up the back of my body. Then I'm going to let the breath out of the back of my body. As I let the breath out of the back of my body is lifted back upright by the pressure leaving my back line. So I'll show that once from the side. It's from the side. So I'm going to pressurize my system. Now I feel the water level dropping down the front of my body. It's at my neck. I keep emptying down through my sternum, my thoracic, lumbar, sacrum. When it gets to the floor of my pelvis, I'm going to inhale. Let that take me deeper, and then let the pressure out as I exhale, and let the pressure bring me back up. Let me do that again without talking once, so I might possibly give you a better demonstration. I'll just say inhalation, exhalation. I'm exhaling, 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 exhaling. And you know what? Let's even start it like this. Let the pressure come out of the front of the head, behind the nose, the jaw, the front of the bottom of the chin, the front of the neck, the front of the thoracic spine, front of the lumbar spine, sacrum coccyx. Then inhale, go deeper. Let the pressure out of the back, and let your body get drawn up. Actually, you should probably just let it roll up. Let it get rolled up by the exiting pressure. Do that again. Pressurize the whole system. Empty out the front of the head, front of the neck, front of the thoracic spine, front of the lumbar spine, sacrum, coccyx, pelvic floor. Inhale, go deeper. Let the pressure out to bring your body back upright. Can you guys put your cameras on so I can see what you're doing? Can you guys, let me see. Let me see. And then just put your cameras on, and then go back to going on your own breath. All right? I want to see you go on your own breath. That's good. I can see. Pressurize the whole system. Tatiana, that looks great. And then empty and let yourself roll down. Empty the front of the body. Feel it like a water level dropping down through a bathtub, any kind of container. And it'll drop down. And then as you let the pressure out, let it draw you back up. Good. Keep doing a couple more on your own breath. And you can play with whether you want to. You can play with whether you want to roll down the spine or whether you want to go down with your back straight. Either of those is fine. Either of those is fine. Let's do one more. If you've been rolling down, go down with a straighter back. And if you've been going down with a straight back, go down with the rolling back. Either way, the main thing is empty to go lower, fill up, go further, empty to come back upright. Let the emptiness do most of the work. Really, like almost all of it, really, is done by the emptiness. And if your hands are going all the way to the floor, just let your hands go to the flat on the floor and give the floor a little push, like just enough push to engage every muscle of your upper extremity and your lower extremity when you're on the bottom. Just give the ground a little engagement with every muscle you have. Wonderful. Now, let's do some side bending. Let's do this from the chair. I think this is the best way to go. Let's do this from the chair. So, here we go. All right, so what we're going to do is we're going to do right and left. Oh, my goodness. Huh. I don't know what I'm doing there. Sorry, Grace, I hope you're back in. No, except now there's several of you. Wonderful. More Graces. Okay. So, we're going to pressurize the whole system, and then we're going to do right-left arm-leg breathing again. So let's pressurize the whole system and do an arm and leg breath on each side, at least one round, okay? Toes lifted, fingers spread. Relax every muscle as you exhale. Then on your next breath, you're going to start with the right side. You're going to lift the toes. Engage all the muscles of the lower extremities, including the butt cheeks. Let the wave come from the bottom to the top. Engage all the muscles of the upper extremities on one side and then go to the other side. Fill one side up and then empty it all the way back down to the bottom. And then do the other side. Keep doing that. Now I'm going to explain what we're going to do next while you keep doing that. So what we're going to do as we, if I just relax the left side, I'm going to let the emptiness lift my arm up to the right, emptying along the thumb side of the arm until my arm is overhead. Then I'm going to inhale, reach my fingers up. I'm going to let the pressure out of my arm, out of the pinky side of my arm, and that will carry my arm down. I should be about halfway through my exhalation, and I'll start letting the emptiness come down the thumb side of this arm into the top and back of the socket for the humerus. When I feel resistance, I'm going to inhale, reach my fingers out. Contracting every muscle of the upper extremity and really especially engaging up the pinky side of the arm. Then I let that pressure out of the pinky side of the arm. I should be about halfway through my exhalation, when I have it down, and then I just keep going on the other side. Emptying down the thumb side into the top of the shoulder. And I'm going to inhale. I want to feel the breath. I want to feel the breath coming into my arm and making my arm longer and fatter as I inhale. Empty down the thumb side. I have to empty the top back of the shoulder. Tara's here. Smiles are happening. Tails are wagging. Everybody's happy about it. Let's do a few more of those to each side, okay? I have to empty down the thumb side into the top and the back of the shoulder. And then I'm going to inhale and let it take my arm and leg further away from each other. I let breath out the pinky side of the arm all the way into the armpit and actually into the inferior posterior part of my arm bone socket. I'm halfway through my exhale. Should be about halfway through my exhale as I come through the midline sort of neutral position. Feel the emptiness lifting the arm up. Last one. Empty down the pinky side of the arm, pinky side of the elbow, along in here, and into the bottom of the arm socket. Emptiness coming up from the thumb into the shoulder. Fill. Let's come to rest. Take one last arm and leg breath with everything you've got, all 20 digits. Is a toe a digit? So now we're going to do some twists. So the way I'd like you to do the twist, I like to do it with my hands on my knees. I like to do it with my hands on my knees. And the way I like to do this is I like to pressurize my whole system. You can just practice breathing, arm and leg breathing while I explain, or practice right and left breathing. It's good to just keep in that flow. Now the water level is going to drop through my head as I exhale. I'm going to feel it drop through the base of my skull, the right side of my neck. I was just doing the neck. Let me start over. Hold on. I'm emptying down through my head, and then I'm going to let my neck go. Now I'm going to continue to rotate through my thoracic spine, emptying all the way down. On the right side to the bottom of the pelvis, Then I'm going to inhale on the left side and reach. As you exhale, you don't have to reach like that if you don't want, but I was just trying to exaggerate to show you. Now I'm going to empty the left side. All the way down into the left pelvis, pelvic floor. Inhale, go deeper. Let's do that 2 more times to each side. Let the exhalation bring you back to neutral. Empty the right. And do this on your own breath, of course. You don't have to use my breath. Blank. Let your own breath dictate how fast you go. One more to each side. Excellent. Let's do a self-massage. Thank you. I've kept you over, so there's not much time for questions or comments, unless somebody has something burning that they wish to say, ask, do. Are we good? All right. I hope everybody has a beautiful day. Thank you so much for coming. If you have any questions, I believe this is an office hours week, okay? Bye-bye.